try to minimize the distance that you want to move her, which means getting the chair as close as possible. So you're going to get it close to the mat, and it's going to be slightly angled. Okay. Then I'm going to try. Then I need to get her forward in the chair. Okay. Position her feet, and then move her. So now, the age-old question comes: do you keep the arm of the wheelchair on or off? And my answer to you is it depends on whether it gets in the way. The lower the transfer, the lower the body part moves, generally speaking, you need to move it out of the way. As they get more independent and they rise higher, you can leave it on because it gives them also a support for their arm to push off of that's higher. But if I'm doing a dependent transfer, most of the time I'm going to take this off. Now we're going to assume it's still on because I'm going to move her forward while it's still on, while she's got support on both sides. But let's get used, we're just going to do that. So I'm going to bring her feet, and I'm going to need to try to move her a little bit forward. And I'm going to just drag her, right? Because I can cause some shearing underneath. I can cause some skin breakdown. So I'm just going to move her to the side. Just kind of come over and rock her a little bit.
And that's your shift and lift general movement. You remember the shift and lift we kind of talked about, getting a person to the edge. So that would be assisting to the edge of the chair. It's like number 6 on our top 10 here. So it's number 6, assist to the edge of the mat bed chair is shown with a forward hip movement. So that's basically what Dr. Krinchicki just did.
So I got her far enough in the chair that I can get her weight over her feet. Because in a dependent transfer, even though her feet and her lower extremities may not be functioning, I can use them as the pivot point to be able to move her. Because again, we're not lifting. You've got to get out of your head the idea that we're lifting patients. We're transferring them by using the mechanics and leverage systems. So I'm going to take the arm of the wheelchair out. I'm going to get her feet on the floor underneath.
And notice the feet that have to be flat on the floor. You really want them flat if you can, because that's going to be your pivot point, the patient's pivot point.
And I'm going to get the one towards the mat slightly ahead because it helps with the pivot.
That's right. It's going to be like this. The patient's going to be like this, slightly ahead.
And if you don't have to remember, all you got to do is figure out to do it. If I put here and I try to turn it this way, what happens? I get caught in the way. If I move it and I try to pivot, it's just a real easy pivot. Okay, so you don't get their legs caught up underneath her. All right, I'm going to get underneath her. And I'm going to use this as my pivot point. So this is where I'm going to be, is down here. I'm going to get underneath, grab her pants. Okay. And from this point, I'm going to use a little bit of momentum. And momentum is, I'm not doing this. Okay. This doesn't help me. What I need to do is really start to move so that by the second or third time, she's coming off. And right here, she's just, okay. And if you notice, where do my knees hang? I'm still controlling her knees. Okay, so she doesn't slip out from underneath me.
She's got the knees to, remember to use the knees or not to use the knees, that's the question. In this scenario, you really do want to use those knees to kind of lock her in place so that you can pivot around that point. Okay, so that's her pivot point. You've got all the control.
And then to go back, it's going to be exactly the same thing. Except I'm probably going to move her from here to here. Because again, I want to minimize the distance because it makes it easier. So I'm going to get her feet here. Okay. Feet down. Grab her pants. Just move over here. Reposition myself. Make sure her feet are on the ground. It's 1, 2, 3. And she's over. Good. How do you feel? Right? Better sometimes.
You were gripping.
I'm sorry.
And you were gripping like the back of her